you. Healthcare under increasing scrutiny as presidential candidates and companies grapple with the challenges of an aging population. Teladoc Health is the oldest and largest virtual care company in the United States, serving remote medical care to over 23 million members worldwide. Listing on the New York Stock Exchange in 2015, it was the first virtual healthcare company to go public and currently serves more than 40% of Fortune 500 employers. Joining us now is their CEO, Jason Gorevic. Jason, thanks so much for joining us. Good to see you.
Good to see you. Thanks for having me.
So remind us of the headline idea. This is FaceTiming your doctor for an appointment as opposed to needing to go and visit them in the flesh.
Yeah, we do video visits, we do chat, telephonic interactions all around the world, and we'll do that about 4 million times this year.
How simple is it to initiate those types of appointments? For example, can a doctor sign up for an hour or an afternoon to do some appointments in the same way that someone that owns a car can to be an Uber driver for the afternoon?
Absolutely, they can. They can come on for an hour, they can come on for a full day, they can come on for a single visit if they have a cancellation in their own schedules.
And does it ultimately lower the cost for the patient?
Definitely. The cost of delivering care virtually is significantly lower, probably about a third of what it costs to deliver care in an office.
How do you assure patients that it's sort of safe and private? I can imagine FaceTiming with a doctor, perhaps I've never met before, about a personal medical issue. Might be a bit of a hurdle for some people to get over initially.
Well, so we're not using FaceTime. We're using our own proprietary application that is highly secure and confidential for the consumer. More to the point, we use tremendous quality control efforts to make sure that the medicines that's being delivered is being delivered by excellent physicians in a way that's highly consistent with the best practices.
You see some reports of the likes of Amazon planning to launch rival products, Amazon Care. Do you see that as a significant threat or something that vindicates your business model?
I think it's tremendous validation. I mean, Amazon's a client of ours. They launched virtual care as an addition to their clinic strategy for their own employees, and I think that just underscores the value that they see from virtual care for their employee base.
There have to be obvious limits when you're doing virtual care. There's only so much you can do without actually being in the presence of a physician. How do you understand as a patient or educate the patients on what this could be used for and when it's just not an appropriate tool?
Of course, we're not suturing a laceration or setting a broken bone virtually, but patients are pretty good at understanding what's appropriate and what's not appropriate. About 92% of our users actually get their issue resolved the first time without needing to get follow-up care in person.
You just come out with your mental health survey. Main takeaway for you along the lines of how many people have these issues but don't talk about them?
Well, we did. We engaged in a tremendous global research study. Really, it wasn't to identify the global mental health crisis. I think that's pretty well accepted at this point. But it was to understand the role in the workforce and the workplace relative to mental health care. Consistent with the overall data, about 1 in 4 people, adults worldwide, has a mental health issue. But the issue is even more extreme than we thought, where 82% of people globally who have a mental health issue were afraid to talk about it at work.
Is that something that your platform can help? Can you do sort of psychological visits over your platform?
Definitely. We have a tremendous and rapidly growing mental health business. And mental health delivered virtually really helps to break down the stigma, which is the biggest issue that people in the workforce said was a barrier to them talking to somebody at work. They said overwhelmingly they were afraid that it would be a career-limiting discussion.
Jason Gorevic, thank you for joining us here to talk about your company and virtual care. This is certainly not the end of the discussion. Hopefully you'll join us again.